So you've probably seen all the typical cues given for performing a push-up, maybe from Squat University or some other YouTuber who really emphasizes a few things such as corkscrewing the hands into the ground, spreading the floor apart, keeping pressure on the outer palm, retracting the hell out of that scapula in order to get maximum stabilization. Well, what if I told you these cues are actually limiting your gains in the gym, as well as possibly contributing to your shoulder pain and dysfunction? So, we're going to take a look at some of the things that I think are underutilized when looking at the push up. So, we're going to take a look at the rib cage and how that plays into everything. I want to take a look at the scapula, and we're going to take a look at how some of the breathing cues can actually help reverse some of the damage being done by these unnecessary cues with external rotation. So, what most people's push ups are lacking is a proper eccentric control of the pecs. Now, how do we accomplish proper eccentric loading of the pecs? Well, we have to start paying some attention to the rib cage. So I know a lot of people will dismiss anything around the rib cage, um, usually because it's related to PRI. Those of you who aren't familiar, that's Postural Restoration Institute. And they do tend to get a bad rap in the PT and fitness world. And I think for good reason, as a lot of that obsession over posture can lead to a lot of neuroticism and an overall reduction in intensity of training, which we know is not ideal. However, if there's one thing I'm going to take from PRI and find good practical use of, it's paying attention to the rib cage. So, with eccentric loading of the pecs, as we all know, it's important to perform every exercise in its eccentric and concentric phase. However, when we're going into excessive ER, which keep in mind, excessive of anything is not ideal. So while yes, the external rotation cue can be done properly and for many individuals is a great cue, there's many who excessively externally rotate and go into some minor compensation patterns such as anterior pelvic tilt. That's going to more than likely disrupt the push-up in the scapular rhythm and the rib cage in some capacity. So when I say eccentric loading of the pecs, that's going to come down to our rib cage control. Now we need to keep in mind that the pecs connect into the rib cage, and we want to think about the effect that has on the movement. So if we are overly compressing our rib cage in the back here around the thoracic area, we aren't able to get proper expansion of the pec fibers, particularly the clavicular and sternal fibers of your pecs. So just to put it in quick perspective, when you're going, let me go to my good side here. When you're loading into a push-up and you're closing off that space in the back of your rib cage, you're no longer eccentrically loading your pecs. Instead, you're offloading that tension into your traps and your lats, which is not the whole point of a push-up, although bench press does apply here as well. Our whole goal here is to get constant mechanical tension on the pecs. That's especially if your goals are for hypertrophy. Now, if your goals are to do as many push-ups as possible in a push-up competition, fucking go for it. Do whatever compensation pattern is going to get you that 100 push-ups. However, for most people, we just want our chest to look good. So it's important that we drop the ego and we perform these push-ups with integrity, keeping what I call the stack, or I shouldn't say I call, what PRI calls the stack. So we have the rib cage in line with the pelvis. Usually we have this idea that posture is a perfectly straight spine. However, PRI looks at things a little bit differently. It's more about stacking the diaphragm over the pelvis and keeping the head in line as well, while maintaining a natural curvature of the spine, which I think is something a lot of people can agree with. I don't find that take too controversial. So, anyways, when we are performing a push up with this stack, what we're allowing is not only proper expansion of the pecs, but a more favorable position for the shoulders and the scapula. So, when we don't have a stack and we are what I most often see, especially in powerlifters, which is my background, is we tend to be in this more extended posture. Now, we could go into different infrasternal angles and who are the more common prototypes that or archetypes that we're going to see really exhibit these compensatory patterns. But for now, let's just keep it simple. So, a lot of times, if you notice for yourself, you have a tendency to extend and arch the back as a power lifter would during a bench press. While yes, it's going to put you in a favorable position to produce force, it's not ideal in the long term as we're, like I said, offloading tension to other areas. So what I want you to do is focus on keeping that neutral pelvis and ribcage stack. You can exhale between reps in order to feel that rib cage depress down, and then you can inhale and look for what's called posterior expansion of the rib cage. So without getting too complicated, we want to feel the area in our back expand with each breath. Doing so is going to put us in a favorable position where our shoulder is less likely to glide forward, right? We talk about anterior gliding of the humerus, which is exactly why we're doing the external rotation cue in the first place, is to avoid anterior gliding. However, if we're posteriorly compressed, we're actively working against our biomechanics and we're not quite able to perform the push-up without some anterior glide. So although we're forcing ER, our rib cage is telling us another thing. We're putting our rib cage in a less than favorable position to produce force without an anterior glide. So simply put, the way our rib cage is positioned is causing us to have a tendency to tip forward, but we're cueing with our hands the opposite. We're fighting. And you think that's not going to create any level of dysfunction in the shoulder? Of course it is. Forcing yourself into that rigid external rotation bias falls short for a lot of individuals. Now, don't get me wrong, there are individuals who absolutely will benefit from more of that external rotation bias, but people such as myself with that more anterior tilt presentation and already plenty access to external rotation still find plenty of pain, especially as we get deep into that push-up. And so I think that's where the main limitation is forcing ER on somebody who's already biased towards ER. So I have noticed wonderful, tremendous changes in my shoulder since I started including some internal rotation. Now, this doesn't mean that I went straight to bringing my hands in and doing the reverse of the corkscrew. I still work in that corkscrew cue. However, I am more mindful of also accessing internal rotation at certain phases of the push-up. So, depending on where you're at with your injury, if you are dealing with shoulder pain, you're just going to want to regress accordingly. So, the easiest regression being a wall push-up. So, for anyone who has had a major surgery and is just coming back, or somebody who is elderly and very arthritic in their shoulder, would definitely be a good idea for them to start with a wall push-up. However, then you would shortly want to progress to a incline push-up at varying levels. Then we're going to go to a knee push-up, a kneeling push-up. So heavy on those front hands, slowly lowering down. And then we're going to obviously want to, at the end, get ourselves all the way to a full push-up. Okay, so on whichever regression you're able to do, here are the things I want you to focus on. So first things first, our starting position, just want to make sure we have that stack. So in order to do so, we want to bring the shoulders down. Think about keeping shoulders away from the ears, but without overly retracting. So people will often say shoulders back and down. I actually like to just cue shoulders down, and the shoulders will naturally get some slight retraction without having to force that ER. And we're going to want to do so while keeping in mind the integrity of our rib cage here. So we're not extending, but we're also not overly rounding here. So nice and neutral. One thing I like to do, I don't want to overthink it. So I just go shoulders down and then exhale audibly through the mouth. Now feel for that positioning that we've found with the rib cage. Should feel nice and in line with the pelvis. You just want to bring the head back a bit, okay? So breathe in. Now, what I'm doing to allow proper scapular dynamics is I'm allowing some freedom of movement. So rather than being rigid and stuck in that ER here, so here's what I don't want to do, right? Well, I'm able to get good strength and I don't feel too much pain in my shoulder. I am closing off at the rib cage and I'm not getting that proper expansion. So long term, it's not going to be ideal. On top of that, I'm really only working triceps, lats, and traps. I want to target the chest. I can feel a night and day difference, and you should too, if I lower, thinking about that, keeping a constant angle with my body that is unwavering through the full movement. No collapsing in either direction. Exhale, get that rib cage down. Inhale through your back. Okay, so keep it simple. Before you come down into the push-up, exhale, feel for that rib cage come down, and then inhale through the back. Push away. And as again, get that slight protraction at the top. Okay, so if your push-up feels a little bit shoulder dominant, a little too tight and underwhelming, like you're not getting the amount of pec activation you'd like, give these things a try, right? Start focusing more on that rib cage control. Hopefully slowly over time, you'll be able to notice a bit of reduction of symptoms in the shoulder while pressing, or in this case specifically push-ups. And I want you guys to just see if you notice more pec activation, a bit smoother reps. Of course, you're not going to be able to do as much weight. I love to hear some feedback. Any criticisms you have, let me know as well. I'm always open to creating discussion, as that's part of the reason I created this channel, was to hopefully get like-minded individuals to challenge some beliefs. Yeah, so my phone died right as I was wrapping that up. But I didn't have much left to say. Just let me know if you guys enjoyed the video. Feel free to comment and talk shit. It was just me rambling mostly. Gonna look to actually edit these properly in the future. Right now I'm just kind of trying to get some reps and, get a feel for this whole YouTube thing. So yeah, let me know what you guys think.